Glasgow Coma Scale, GCS scores. GCS most commonly stands for the Glasgow Coma Scale, a medical tool used to measure a person's level of consciousness. It is a standardized 15-point scoring system used by healthcare professionals to measure and document a person's level of consciousness, particularly following head trauma, brain injuries, or acute medical emergencies. So how does it work? The test evaluates three distinct parameters, commonly remembered by the mnemonic EVM, which stands for eyes, verbal, and motor, and adds the points together for a total score. First point is eye-opening, ranging from 1 to 4 points. This evaluates if the patient opens their eyes spontaneously, to sound, to pressure or pain, or not at all. Maximum scoring of eye-opening is 4. 4 points are given for spontaneous. Patient opens eyes on own. 3 points are given to speech. Patient opens eyes when asked. 2 points are given to pain. Patient opens eyes only when pinched. 1 point is given to none. Patient shows no eye opening. Second point is verbal response, ranging from 1 to 5 points. This assesses if the patient is fully oriented and conversing normally, confused, using inappropriate words, making incomprehensible sounds, or completely silent. Maximum scoring of verbal response is 5. 5 points are given if patient is oriented, knows who, where, and time. 4 points are given if patient is confused, speaks, but is disoriented. 3 points are given if patient is saying inappropriate words, said randomly or yelled words. 2 points are given if patient is saying incomprehensible sounds, patient, moans or groans. 1 point is given if patient is not saying anything, has no verbal response. Third point is motor response, ranging from 1 to 6 points. This tests if the patient obeys simple commands, localizes pain, withdraws from pain, has abnormal flexions or extensions, or shows no movement. Maximum scoring of motor response is 6. 6 points are given if patient obeys commands, follows simple actions. 5 points are given if patient localizes pain, moves to push pain away. 4 points are given if patient withdraws from pain, pulls limb away. 3 points are given if patient shows flexion to pain, has abnormal bending of arms. 2 points are given if patient shows extension to pain, has abnormal straightening of arms. 1 point is given if patient shows no movement. After this, we will be interpreting the score. 13 to 15 scores show mild brain injury or normal alertness. 9 to 12 scores show moderate brain injury or impairment. 3 to 8 scores show severe brain injury. A GCS score of 8 or less is widely considered a clinical threshold, where doctors may need to intubate the patient to protect their airway. 3 scores show the lowest possible score, representing deep coma and unresponsiveness.